Guys, welcome back to Medical Coding with Blue. Today's episode is all about what you should know about remote medical coding. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so you want to become a remote medical coder. Maybe this is how you got sold the field from the school that, oh yes, you can learn in our program and be on your way. Once you get certified, be on your way to being a remote medical coder and working at home. You could spend more time with your family. You don't have to leave the house. And it just sounds fantastic to you. And maybe this is why you're so excited about it. But I want to tell you guys some things. And I'm not telling you guys these things to get you discouraged or to change your mind. Because obviously you're already in the program. But this is what you ought to know, guys. This is what you ought to know, okay? This is what the schools don't tell you. This is what those little threads on Facebook don't tell you either, okay? There's a lot of things that you have to know. Book coding and real world coding are two different things. The book is always going to have all of the information that you need, and you're not going to have to query because it's perfectly written. In the real world, you will have to query. Okay, you will have to query. And when you're first starting out, you've got to learn a brand new thing called the electronic health record. You have to learn to navigate. And yes, while they do have these little programs to help you to learn how to use the electronic health record, it doesn't necessarily mean it's going to make sense to you right away. I get lots of emails from people saying, oh, Blue, I'm not really tech savvy. You're not tech savvy, but you want to work in an electronic health record in an industry that requires technology. Does this make sense? So when you think about this, guys, the electronic health record, yes, you can learn it, but it does take time. It's just like learning real world coding, all right? And different facilities have different rules, different insurances have different rules, and these are all the things that you are trying to do by yourself right off the bat, working remote. And for those people that say, oh yes, it's real easy for you to find a remote coding job. No, it isn't. Before the pandemic happened, if you didn't have 3 to 5 years of experience, you were not working at home. And the reason that is because you have to know how to problem solve on your own. You have to know what you're doing when it comes to the coding so that you're not having to ask 100 questions a day trying to get through. Because when you're stopping somebody from their work because you're asking them a question and you keep doing this, then they can't work. Now the company has 2 people that are not working up to full speed because they're trying to help you, right? It's the other person in you trying to get this thing going. And while it takes some time to learn, and it's not impossible, this is why companies don't like to do it for brand new medical coders. And yes, again, there's going to be some companies that will allow that, but there's a lot of them, and more every day, that are not doing it, that they're requiring experience. Because, again, it's just easier for the company. Remember, no company owes you anything. No company in this industry, in health information, owes you a job. No one owes you anything. So that's why you have to make sure that you are prepared when you're going in. And how do we do that? I always tell new coders, make sure you're applying someplace where you have to physically go so that you can get hands-on training. So that when you're learning the electronic record for the first time, that you're able to have somebody to ask questions with. And when you're getting stuck on a coding problem, you're not sitting there spinning your wheels trying to think of how to word the question, because then you're right there with the person and it's much easier. A lot of people are trying to get away from, being around humans and human contact and things like that. Oh, I don't like that. And, I just feel nervous and anxious around other people. I think for some people, it's not legitimate. This is just because it's more comforting to you. It's something that is unknown. So it's not a legitimate concern. And yes, you can absolutely work around other people. It's just that you don't want to. And you haven't built up the time in the industry yet to be able to get that. Now, when you do have experience, and then it's totally fine. Work remotely. That's okay because you've built up your time in. At least get 6 months on the job, at least 6 months where you're trained somewhere, and then move on. And it is okay to start someplace and then be applying and still get your experience in and then work remotely later. That's okay. You don't have to worry about staying in one place for a whole year. My first year in coding, I started off at the Cancer Therapy Research Center, and then I went to a hospital, and then I went to my forever home, which is here. So 3 different places I worked in the first year, all within the first year. So it is okay to move around a little bit, but getting that in-person practice and getting that in-person exposure is really going to help you, because if you're not getting that right out of the gate, you're missing out on a lot of that brand new coder development. And how you develop as a brand new coder will really impact the rest of your career. Now, all that to say this, sometimes when people are out there and they're applying for these jobs and they say, oh, well, the interviewer's asking them, why do you want to work remotely? And then you say it's because you want to be at home with your kids. And then you wonder why you're not getting called back, because they know that you want to stay home with your kids. They don't need to know that you want to stay at home with your kids. What they need to know is that you can focus on what you're doing at home, because what happens is a lot of people don't treat working at home like they would working at the office, and you're supposed to. You're supposed to treat that time and devote all that time to your work, okay? Because you can't just stop and start when you're at home. I don't care what anybody says. I've worked at home twice, and I know what it is. I know how you're supposed to behave when you're working at home. And people who take advantage of their supervisors and say, oh yeah, I called my boss and I told her I'm going to go run some errands and I'm going to come right back. Do you think that lasts for very long? I mean, once in a while I can see and I can understand because things happen, emergencies happen or whatever. But when you're consistently doing this, do you think you're going to stay there very long? Probably not. So again, if you are wanting to stay at home and work and be a brand new medical coder, then you better bring your A game. And you better tell them why, a legitimate reason why that you want to work at home. And you can tell them because you focus better, when you're by yourself and that kind of thing. But don't bring your kids up, and don't bring that up. Or if you're taking care of a sick parent, don't bring that up, because they don't need to know that. That's none of their business. And again, you want to get the job at home. Okay, well then you better make sure that you're self-sufficient too, that you can answer your own questions. Because people who want to work at home and be trained and be handheld the whole way, that doesn't work either. And then they're upset and, they're questioning, why did they get fired? Well, you got fired because you didn't do your job. You didn't do what you were supposed to do. Oh, I'm going to get a mouse mover so that I can go run out and do errands and do all of these things. Okay, mouse mover. Then when you're getting audited, because they will look at how long you spent in that record. And if they see that, oh, you're supposed to have been coding an appendectomy, which is a very simple, straightforward procedure to be able to code, and you spent an hour in an appendectomy chart. Why? Then they're going to be looking at all the things that you are doing. Oh, that's okay. I can make it up when when I go off the clock. No, you can't, because again, that's a HIPAA violation. Why are you in a record when you're not on the clock? You have no business being in there. What are you doing? So that's the thing that you got to know, guys. You have to pay attention to those details. Those are the things that you need to know. And for my folks that think, oh yes, well, I want to work remotely so that I can travel and do all these things. Let's talk about logistics here, all right? Let's talk about the setup of what you need to have when you're working remotely. So when you're working remotely, it's not just that you're working from a laptop. No, you need a minimum of 2 screens. One for your record and one for your encoder. So that way you can have the space to work. Some people do work on a single laptop, but if you're working on a single laptop, then you have a very small window and it's going to cause eye strain and all these other things. So it's always better to work with 2 different screens. Now, you have these 2 screens, right? Are you set up at home like you're supposed to be? If you're out there traveling around willy-nilly, oh yeah, well, I'm just going to be over here at the beach and I have my 2 screens set up. So somebody can walk up behind you and see your screen. You've just committed a HIPAA violation because you allowed somebody else to see your screen. And I want you guys to think about this. For those people that are so excited about working at home and they want to do that, think about how you would feel if it was your medical record that somebody could just willy-nilly just have out in the public and showing to people, because they don't care. It's about them and it's about what they want to do and it's how they want to work and things like that, because they're not concerned about you and your record. Think about that. And again, there's so many people out there that are having that attitude and having that mentality that, yeah, that you can do that. No, you can't. And I don't know where this is coming from, if it's coming from the schools or who's trying to sell this package, but that's not the way that this goes. When you are working remotely and you're working at home, you need to be set up in a way that protects the patient information at all times. You can't be in a big room with your computer exposed to the entire room. Your screens always have to be facing a blank wall so that nobody can walk up behind you and look at what you're doing. It doesn't matter if you have kids in the house and they're teenagers. One comment really irritated me because it said, oh, for gosh sakes, it's just a 16-year-old. It's not a HIPAA violation. Yes, it is. That 16-year-old has no business looking at somebody's screen when they're working and there's protected health information. It doesn't matter how old the person is. It's still a HIPAA violation if they don't have a need to know, period. And if you don't understand that, then you really don't belong in this field. I'm just saying. So I want you guys to know, I'm not telling you guys these things to get you all, no. What I am telling you is that people are not taking this seriously, and then they're wondering why they can't get hired to work remotely. Because again, you have to have these 2 monitors. They have to be set up in a way that no one can look and walk up behind you. You have to be able to concentrate on what you're doing. This means that you cannot stop every 5 minutes to go feed the kids or put the clothes in the laundry and do all these things. You can't be doing that. You have to treat it like you're at the office. And then when you're trying to sit here and query the provider, you think that provider is really going to listen to you if you're a brand new medical coder, don't have any idea what you're doing, and it's clearly showing in your emails, and then you're sending them a bunch of queries? Do you think they're going to listen to you? Probably not. Probably not. Because first of all, you don't know what you're doing. Second of all, you haven't made an attempt to get to know that provider before sending a query to them or asking them questions and things like that. You haven't made that effort beforehand. That's very important. You know, part of what we do is query. Part of what we do is educate. And if you're not around these providers to be able to do all that, you're not going to be able to get the most specific codes out of these encounters like these providers should have from their coder. And like these patients should be getting appropriate bills and things like that. Okay? So that's the thing that you have to also think about too, is that it's not all sunshine and roses like y'all think it is. You know, it's just one of those things that irritates me so bad is when I see brand new medical coders do that they think that this is going to be something so easy that they can do at home. Or my nurses that write to me and say, well, I was a nurse and I did bedside for 25 years, 30 years, and I don't want to be at the hospital anymore. It's not about what you want. And you're not going to be having exposure to patients anymore. Medical coding has to do with looking at the documentation, not contacting the patients. Now, if you're contacting patients, it's because you're doing billing, okay? That's something completely different from coding. Coding is we're looking at the documentation, selecting the appropriate codes for billing and statistical purposes. So that way, you know, everything works out and we have good data coming from this facility and that kind of thing. Your main concern as a coder is working with the provider, not the patients. So again, I don't care if you're tired of working with patients and you don't want to be in a hospital. It doesn't matter to me. When these companies are looking to hire, they're looking to hire competent people who can code. And if you say to me, well, Blue, you know, I did, you know, my 30 years as a nurse and I did all the coding. What is coding to you? Oh, well, we had a sheet where we had all of these common procedures listed and common diagnosis, and I just checked them off. That is not coding. That is not coding. Coding is when you look at a document and there's a diagnosis codes, maybe more than one, right? And procedure codes, modifiers if they apply in that situation, evaluation and management if it applies in that situation. And you have to make sure that all of those are accurate, that are already pre-selected, because sometimes the electronic health record will pre-select codes. But again, 98% of the time, it's not going to be right. Something's wrong, they're in the incorrect order, or those codes don't even apply in that situation, or they're unspecified, so you would have to go in there and change them. So there's a lot more to it than just checking off boxes. And that's not considered coding. It's looking at the documentation, reading it, comprehending it, and making sure that the appropriate codes are selected and updated if they need to be updated. Okay? So that's something that you got to know. And working at home, don't think that you can be, oh, I'm going to work at the night shift and I'm going to do third shift. I'm going to do graveyard shift. No. Why? Because the providers need you to be available when they are in the facility. Again, not what you want. Now, there may be contracts out there when you have experience and things like that, oh yes, we have just backlog, so you can code it whenever you want to, and that's different. But I'm talking about new people who are out there applying, and they think that this is what they're going to get into because they think, oh yes, I'm going to be able to do graveyard shift. I have a day job during the day, and I can do this at night, and I can make all this money. No, no, that's not the way that it works. And especially when you're brand new, you have to work at the hours that they say, because even when you're looking at these remote coding jobs, they will tell you a candidate must be available during 7 to 3 o'clock, Central Standard Time, or 7 to 3 o'clock Eastern Standard Time. So if it's 7 to 3 o'clock Eastern Standard Time, you think about that if you're in the Central Time Zone, what your hours would be, because you have to adjust to their time. Same thing if you're on the Pacific Coast. You have to adjust to the hours that they want you to be at. Okay? And not only that, sometimes when you're working remotely for these companies, yes, you can be anywhere sometimes, like in the United States. However, sometimes you can only be in certain states. And if you live in a certain state, then you can't work for that company, because different states have different rules when it comes to employment and things like that. So that's the thing that you also have to consider too. Again, it is not about what you want, and it's not about making what you want work because you're spending so much energy trying to focus on that. You should be spending your energy on learning about the coding so that you can be prepared for this job, so that you can get your experience in, so that then you can get what you want to do after a year or 2 years of working wherever. Then you can work remotely and say goodbye to the office all you want to. But there's just some things that it's better when you are in person, and especially when you're brand new, this is one of those things. Because again, it's not all fa la 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 when you're at home. And some people don't realize how lonely they can get especially if you've never worked at home on any job at all, and all of a sudden you think, oh, working at home will be great. You would not believe how it changes. It changes your mood, changes your attitude. Trust me. The first time I did it, the first time I worked at home remotely, it was okay because I still had lots of socialization outside of work. So that was totally fine for me. It worked. It was great. It was fantastic for the experience that it was, right? But the second time that I worked at home remotely, which was during the pandemic, it was completely different. Because of course everybody's isolated and everybody was, in their homes and things like that. I did not do good. I suffered the whole time that I was at home. Why? Because I was used to the noise. I was used to the busyness of the hallway and having my door to my office open and listening to all the chatter out there and then just working. And I could work like that. But being at home, it was so quiet. It was incredibly quiet. And so I had to turn on something just so that I can have background noise, turn on the TV and listen to background noise. And then of course it was just a coverage about what was going on. So I just started putting in DVDs and just listening, So that was the thing. It's not all great. If you don't have socialization outside of work when you're working remotely, it can affect you. It can really do a number on you. And as far as like your mood and attitude and everything else, my mood was not the same compared to when I'm around people, because I am a people person, but I do like to have my space as well. I like the sanctuary of my home to be the sanctuary of my home. I don't like to do all these other things when it comes to work. Now, I will do this, like my YouTube and Patreon and all these other things, you know, my professional coaching and resume, I'll do all of that. That's completely different from the coding. That is, again, I'm telling you, it's better when you're in person. And then if you need to work remotely, you know, later on, then that's totally fine, because then you've built up your skill enough. But when you're brand new, this is not something that you should be doing, because again, all these things that I've just explained, you have to have a good setup, a good safe setup. You have to have high speed internet. You know, you can't have spotty internet connection. Oh, I couldn't connect. And if you have too many of these that couldn't connect, they're going to let you go, because your internet connection is not secure. You know, it's not secure, but it's not fast enough to be able to process all the things that you need to be able to do when you're working remotely. All right. And you can't be out there willy-nilly just traveling, you know, and that's what a lot of people think that they can do. Oh, I could just take my laptop. It requires you to have at least two screens to be able to do this. Otherwise, you're going to have to be sitting there looking at really tiny screens and split the screen and do all the, no, it's just too much. It's too much. And when you have two screens, that's even better. Okay. You're not going to have somebody right there to help you out. And a lot of people want that hand holding and want that, you know, that one-on-one support and things like that. When you're doing this and you're brand new, if you do it too much, you're taking somebody else's time. You're taking somebody else's time away from their work, because you can't figure something out on your own. And sometimes you don't know how to ask the question. You don't know how to ask the question. I've been there as a brand new coder, not knowing. I knew I had a question, but I didn't know how to ask the question, because I didn't know, like, what do I say? This is brand new. I don't even know. You don't know what you don't know, right? And so that's what I was going through when I was a brand new coder. But then after a while, I learned. And then after a while, you will learn. All right? But I'm telling you guys, working remotely is not all it's cracked up to be. You're by yourself. You're very dependent on yourself. You have to work the hours that they say that you have to work. And it's not willy-nilly what hours you want to make up. Oh yeah, I'll make it up later. No, you're not supposed to be on the clock after you're done with your shift. You're not supposed to be there. You're not supposed to be doing all that. Again, it's about, you know, adhering to their rules and not trying to make up your rules. And not trying to be like, oh yes, free willy-nilly and out there. You know, I got a message a while back from this guy. He said that him and his wife want to go on the road and do this. There's just certain professions that you can't do that. And not only that, you want to connect to Wi-Fi, you can't do that either, because that's connection is not secure. Oh, just connect to the VPN. So you think that there'll be enough bandwidth for you to be able to do all your work when you're out there trying to connect to the internet? Okay, so I'm just saying, guys, think about it. If before you even get into a program, okay, if you haven't gotten into a program yet, I'm just letting you know, not to discourage you, but to prepare you. That if you're going to work at home and they're going to trust you to work at home, they want you to be in a secure place, and you need to be able to do your own research. Not that you can't ask questions, but you can't be hounding the person with 100 questions because you don't know what you're doing. Get some experience, go to a place first, make it temporary. If it's just 3 months, it's fine. It's better than nothing, okay? But again, I can't tell people this to work 6 months, because then I get a bunch of hyperventilating emails. They say, I can't do that, I can't do that. Okay, well then you do what you want to then. Good luck to you. But I'm just saying, guys, again, I want y'all to be prepared. I don't want y'all to be out there flailing because no one told you. I'm telling you now that it's not all that it's cracked up to be. And that when you're working at home, you've got to be on your A game. You've got to be able to focus, and you can't be getting distracted by all these things, because you will have a productivity standard and you will have an accuracy standard. And trust me, the productivity standard is going to be a lot higher than if you were in a facility. Because if you're in a facility, they bring that down a little bit because they understand, like, you're going to get distracted. But you're at home, you have no distraction, so there's no excuse, and they will push up that productivity standard. Don't think they won't. I'm just saying. So with that said, I'm going to wrap this one up. Best of luck to you guys out there, and I will see y'all next time. If this video helped you, please like, subscribe, and share, and I'll see y'all again. Bye.